2015 Board of Health meeting to order, please. We'll start up and recite the pledge to begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'll take that. Okay, thank you. All right, so Dr. Leader will help us by taking minutes tonight, as our students aren't here yet. Thank you, everyone, for coming. And we don't have a copy of the previous meeting minutes. I'm not sure if it was my error in sending to Larry, but we will review those and table that until next meeting to approve these minutes before they're published from the April meeting. I will start the meeting, I guess, with the health officer report, please, Mr. Taltone.
Good afternoon. I think we went over part of my report before the meeting started, but during the month of May, we did 35 food safety inspections, of which I think 14 of those were part of two temporary events, one of which was the Wheels of Wayne, which if you did not get a chance to come out, you're missing a good event. I think it's probably one of the best ones the township has. And also the Katie Sampson lacrosse tournament, who, from what I understand, is a former Radnor High School student who injured herself, and this is a fundraiser for that cause. And it also is a good event. We have a few quality of life issues, some dog bites. We had on North Wayne Avenue last month, we had a electrical malfunction underground that put some of the stores out of business for a couple of days. At one point in time, we had, I think, all the food facilities on the street were out for at least some period of time. We got them all back up and running, and everybody's back in service now. On May the 12th, we had here in this very room the Carol Axelrod Memorial Blood Drive, which was from 7 a.m. to 7 p.m. I have not yet been able to get a hold of someone to get the count, because I like to know what the count was so I can report it to the board. That's a basic summary. Also, Mr. Kane, Kevin Kane, said that he would not be able to be here tonight, and so ends my report.
Thank you very much. I was there toward the end of the blood drive on Tuesday. I think it was there about 6:45, and I think I was number 128 or something, donor, number 128. But I think there was a number still after me as well. Great event, and if anybody else, by the way, is interested in donating blood in the township, you can always go to www.redcrossblood.org and find a blood drive near you to donate. A great cause. We'll move into some old business as well. I wanted to see if the student had, if Ritvik's article had gone in yet to the. Okay.
It went in. I don't think it's been published and released to residents yet.
1 more week.
There we go.
Yeah. So it'll be available in a week, and we'll take a look at that. I did review it.
Yes.
It was a great job by Ritvik on chemical safety. Thanks to also Mr. Dooling, by the way, who just jumped out, and for putting slides together for our speakers and for always keeping our IT in check. Thank you. Some older business that we can update folks on: the pertussis outbreak in the Radnor schools. There were, I believe, 7 reported cases. I haven't heard anything recently as anything else new. Obviously, if cases of pertussis get treated, we are keeping other people from getting exposed to pertussis, and we have discussed in the past the need for vaccination for 11-year-olds and for anyone else who hasn't received what's called an Adacel or a TDAP vaccine. Is a great way to protect you against getting the tetanus, against getting pertussis, and it also contains a tetanus protection.
Dr. Foreman, before you go on to another topic, regarding the pertussis, I had heard that there were 12 cases. Excuse me. Did the school district notify you as the chairman of the Board of Health, or you had to read it like every other person?
Reading, hearing, like sort of through the grapevine from my kids being in school. And I think a lot of the reason for that is that there is state policies on what to do with pertussis, and how to go about making sure that people are vaccinated by school records, and then how to deal with the exposures. So there's not much that we do as a Board of Health to recommend to the district. It's more about state policies on vaccination.
Well, I understand that there are policies and it's a reportable illness, but given the fact that I lobbied for someone in the school district to be a liaison so we'd have more communication, would that be something we would want them to just shoot us an email before we have to read it in the paper or hear the hearsay? Wouldn't that be part of the communication that we could ask for?
I think it's a great idea. I mean, to inform the public about what's going on. I think that would be nice to let's see, find someone in the district who might be a nice liaison for health matters to us. That would be great.
Well, I think that's what Mr. Kane's job is. So that, I guess my question is, can we ask if that could be part, rather than, I don't have kids in the schools anymore. So,
Right.
and many people here don't. So the reality is, when I first heard about it, I think there were 7, and then a doctor told me there were 12. Some at the high school, some at the middle school. I think as a Board of Health, we should know that. I understand we don't have jurisdiction, but just as a communication, respectful thing, I think that'd be nice.
I think it's a great idea, and I definitely I will shoot an email to Mr. Kane this month and see if we can arrange something to that effect, that if there are health issues at the school, keeping it anonymous, of course, with names and whatnot, to keep HIPAA laws in check. Certainly a notification to the board might be a good idea, and then I can make some announcements in the meeting. So I think that's a very good idea. So I will do that this month.
Following up on that, I'm just wondering, couldn't the school report to our health officer? Just the numbers, if you have a particular illness. Larry, wouldn't that be a reasonable thing for the school to report to you, and you could include that in your report to us?
If they certainly would do it, I would pass it on.
Yeah,
I don't
that
think
might-
they're required to, but it would be great. Good idea.
As a courtesy, I think, to you, it would be helpful. Thanks.
Sounds like a very good idea to start working on that.
We'll see if it works.
That sounds great. In the past couple of meetings, we've been having a discussion about a mission statement, and Dr. Humphrey was nice enough to put together some kind of a cohesive statement from our Board of Health about some of our responsibilities. And over the last couple of weeks as well, I kind of looked through that and tried to put some other pieces to it. I included a copy in front of all the board members tonight. I think a good idea might be to read this over the next month and think about trying to get this sort of passed through in June as our sort of mission statement. I'll read out loud to the community what our ideas are so far. So we have: the Radnor Township Board of Health advises the Board of Commissioners and the Department of Community Development on matters of public health. The Township's health officer acts as a liaison between the board and the Township administration and reports to them on his activities. The mission of the Board of Health includes science-based recommendations on public health policy, prevention-oriented programs that promote and protect the health of all township citizens, and advocacy for an optimal health environment in Radnor Township. So I think it feels to me still a bit wordy. If anybody likes to work on punctuation and shortening up sentences, I'm happy to take any input that you might have through the month, and then maybe we can get this all sort of hammered out for the June meeting to sort of be our goal to follow these things. And it seems like we follow these things anyway. The mission does include our recommendations to the board on public health policy. It also is what we like to do, these prevention-oriented programs each month. And definitely, I think we are advocates for the optimal health of the township. And as we discuss many things, including, herbicides, pesticides, and animal safety and things like this. So I think it certainly incorporates all of the things that we do here at the Board of Health. So if you guys can help us out a little bit and make this a little bit more in English than I am able to do in a lot of cases.
Dr. Foreman and the rest of the board, would it make sense to meet with the commissioners and say, what's your vision as we prepare this? Because I asked it about a year ago and have received no response. There was a different president at the time. there's so much more that this board could do if we actually were given direction to do it. But why do, I guess this is a great mission statement, but yes, as you said, we do this already, and there are many more things we could in fact do. So if anyone else sees that as a possibility, I would ask not just the one commissioner that sometimes comes as our liaison, but all of them. Are they interested or not? And that's what I'd want to know, rather than just sitting here, because I know many of you have practices and busy lives, and you cut your days short. And I'm very grateful for that, that you do that. I just happen to be lucky enough not to have to do that, but you do have to adjust your day. So I'd really rather us be proactive and make this board matter if it, in fact, is what the commissioners want.
And I think that oftentimes it matters more when there's a fire to put out, and then there's something that happens, and then they come to us and ask us our opinion. But I agree, if there's something else that they want us to do or want us to serve for them, I think it would be great to get their input on this. I'm not sure the best way to go about that either. Is it talking? I mean, they have enough responsibility. They're here every week or two for meetings. They have a lot of obvious things going on in the township right now. Is it best, do you think, to contact each member individually, or by a group email kind of question thing? You said you would like to meet with them, but I'm not sure if that's going to be the ideal for all of us to be able to meet in the same time, in the same range.
Well, obviously I'm speaking off the top of my head, but they meet here at 6 o'clock right after we do. So some evening, how hard would that be for all of them to come and meet with us for 15 minutes? Have a conversation and get the feeling of the group, not just one person. Before we write something, we may get a totally different direction. And of course, just like our board changes, the Board of Commissioners changes as well. But it would be nice to have the flavor of the group as opposed to us. I never cared for reacting, like you said, putting out fires. That is often how, in my previous life, things are done. You react. There are better ways to do that, and if 9 people are committing their time, then maybe that would be a proactive approach.
A quick question. So do other boards, I know there's, Parks and Rec and that sort of thing, do they have a mission statement? Is anybody aware of that? Just curious. And if so, what was the process for developing theirs?
Here's the man who knows.
I'm not sure whether other boards have a mission statement or not, but I do know that it was this board that came up with the idea of creating one a couple of months back for the Board of Health.
So, Mr. Nagel, welcome. We were just discussing a little bit about we had discussed earlier in the year for the Board of Health to put together a mission statement and discuss some of the things that we felt were our job and our responsibility. And the discussion was just going on up here about, if we could meet with or speak with the board about what they want from us as a Board of Health to provide for you folks to make it a healthier township or whatever you need us to do. Instead of, as we were just discussing, putting out fires when they happen. If there's something that happens, then we, give our recommendations. So do you see that as a possibility for us to either meet or talk with the board members to discuss what they would like us to have in our mission statement as the Board of Health?
Well, we've noted with several of the boards, we've had similar requests. And a couple years ago, we started to put together a guidebook for the boards, and it fell by the wayside. So we can reinvigorate that, but I do think it might be useful for 1 or 2 of you to meet with 1 or 2 commissioners and talk through it. The roles, to a limited degree, are all spelled out in the charter and the administrative code. So, and the kind of work you've done in the past is the kind that I think you should be doing when you address issues of public health and public health concerns, and then hopefully stimulating us to take action appropriately. It doesn't have to be reacting to something. It can be self-generated by this board.
Mr. Nagel, my thought was, since the commissioners meet right after this meeting in this room, how difficult would it be for them to come a little earlier, off air? We could just have a discussion with the group to get the group flavor, the entire board, not just a few. Because if you just send two of us, you get two people. But it's nice to have, and as the board changes, at least we'd have who's left and on both sides.
I would be happy to bring that up with the board itself. Recognize, however, for example, I have an exec session starting at 5:30. So it wouldn't be like we could meet before the board meets because we have execs. Also, I think if you look at the calendar, we don't always meet on the same night as the board. One of us is the second and fourth, and one's the third Mondays. Last year, for some reason, we kept falling on the same date. But I'll bring that up. Yeah, see what we can do, yeah.
Thank you.
Thank you very much. Any other old business that anybody had from last? I couldn't remember anything else that was still pending from last meeting.
I just want to add something,
Yeah, please.
old business. After the very informative chemical discussion from the student, I happened to take a chemical mandatory training session with my job. And as of 6/1/2015, all chemicals will need to be shipped with hazards that are in picture format. So they're pictograms on the chemicals. There are about 9 mandatory pictograms. There is one for environmental is not mandatory, but that's to comply with the global labeling format that OSHA's put out. So I can send those to you if you care to send them out with the minutes, or to whomever you wanted to send them out to. But now you'll have pictures to look at for your hazards on your chemicals.
Pretty cool. I did not know that. Thank you for the update. We'll move into new business, and I'll switch things around a little bit if we don't mind. I know we have a little bit of a time issue tonight, so I'll review a couple things. One, as we move into the spring and summer here in Radnor Township, and being that we are in an area of the world where Lyme disease is so prominent, I thought it would be important to just update the community on Lyme disease and the burden of Lyme disease. We know that this season will be a higher burden of Lyme disease because of the weather that we had in this winter, which was less snow and a little bit more wet than typical, which lets a lot of nymph ticks to hatch this time of year. The deer tick, which is the one that is the most concerning of course, for diseases that affect humans, is out and about right now. And we're seeing a lot of cases of Lyme and a lot of ticks on kids and adults. In 2014, there were 3 reported episodes to the health department in Pennsylvania of sudden cardiac death from Lyme, and that is what's called a late-stage Lyme symptom, and really, really very uncommon, to be honest with you. And I feel that sometimes Lyme disease sparks a lot of fear in the community, and a lot of worry because of misinformation about Lyme disease. So I think it's important for us to always remind the community about the basics of Lyme disease prevention, and Lyme disease treatment. Number one and foremost is protecting your skin and checking for ticks. So protecting your skin includes using DEET products that have the chemical DEET in them can repel the ticks and keep it off your skin. We do recommend that DEET be used on extremities, not near the face. And it can be used on the edges of clothing as well to prevent ticks from having the need to attach to our body when they feel the warmth. When they get affected by DEET, they tend to be repelled. The second thing is checking the body when you come inside from being near any kind of outside areas, including woods, gardens, and lawns, and making sure that you're feeling around for any small ticks. They're hard to see sometimes and are often confused with other things in the body, so the best way usually is with the hands to sort of feel around the extremities and to feel if you can feel any small insects on your skin. They are removed rather easily with a forceps or a tweezers, very easily at home. They are not hard to get off. They don't have very large mouth parts, so they don't really latch on too strongly, and a little bit of tension with the tweezers gets them off pretty well. And of course, looking for the signs or the symptoms of Lyme disease is the best way to detect Lyme disease in its first or second stages where it's very easily treatable. And that would include a circular rash, either at the tick bite site, or if a tick was not seen, it could be really anywhere on the body, the circular rash. If that's seen, you should see a doctor. Oftentimes, that's treated without even getting a test. And that should be treated without getting a test. If a doctor recognizes a Lyme rash, it should be treated immediately. And of course, also, the second stage of Lyme disease would be a swollen or painful joint that doesn't seem to have any reason for injury. And that also should be evaluated by a physician to make sure that's not Lyme disease as well. So just by preventing getting the ticks on your skin, getting them off before they've been on your skin for a very long time, and watching out for the symptoms like rash and arthritis or swollen joints can obviously prevent these tragic cases of longer-term Lyme issues, which are what we call the third stage of Lyme, or where the Lyme disease becomes more in the organs, like the brain or the heart. But again, trying to keep the panic down and try to keep people just being aware about Lyme disease. So thanks for your attention on that one. I don't know who wants to start. Amy, do you want to start first today, or Dr. Offit? Well, Dr. Offit, welcome, and thank you for coming to the meeting. Dr. Offit has a great website, which we've talked about before, called Real Talk with Dr. Offit. Is that the correct full
Mr.
name?
Chair, before you start with this,
Sure.
because I'll have to leave for the exec, just want to report to you that this year the Public Works Department is using a citrus-based product instead of Roundup for those edge treatments and on the trail and some of those things. So we'll get reports back on how effective that was.
Excuse me for 1 second. That's the citrus-based treatment for weed control?
Yes.
Okay. It's not a pesticide. We're talking herbicide here.
Herbicides,
Okay.
yeah.
Thank you. Sorry. Turn my microphone on. We've discussed your website before, and I've been actually on it today. And it is called Real Talk with Dr. Offit. Is that correct?
It is, yes.
Okay.
And thanks for the invitation to provide an update, because I know I was here about a year ago. And it's nice to see some familiar faces and to see some new faces. I know that there is a little bit of a time constraint, so you can kind of go like this with the hook if it gets too long. But I try to keep it short. One of the updates I did want to provide is, I know last time one of the things we talked about was just that teens are online quite a bit, which is obviously a statement of the obvious, but also they're online looking for health information. And one thing that I don't know if everyone was aware of was this Pew report that came out just about a month ago. They did an online survey to try and assess what teens' behavior is online, and in particular the impact of smartphones on online behavior. And a couple striking takeaway points here is that nearly a quarter of teens are online almost constantly, and that's obviously fueled by the ubiquitous nature of having a smartphone. And 92% of teens, so almost 100% of teens, are going online every day, which probably is not a huge surprise. One thing that I think is a surprise to many people is a lot of people think that only certain types of teens have smartphones, but actually that's not true. The presence of smartphones actually crosses socioeconomic and demographic boundaries, and African American teens are actually the most likely of any group of teens to have a smartphone. And one of the most powerful pieces, in terms of impact of this fact, is that this is how teens are going online to look for health information, as well as general information. And a lot of teens are actually using smartphones to do their homework because it's the cheapest way for them to access the internet, which is hard to believe, in a township like Radnor where people are equipped with iPads and all sorts of technological support. This is a cartoon I like to use, mostly to just illustrate a point with young people, but also with adults, is, there's a lot of beauty and strength in the internet, but you have to be cautious with where you go looking for health information, which this is part of the reason I'm passionate about what I do. I don't know if anyone remembers the headline from about a year ago where they had come out with a study looking at Wikipedia, and they did a spot check to see if you spot checked 10 different medical topics on Wikipedia, what % would have inaccuracies in them. And this is a question I like to bring up in front of young people when I speak to them, because Wikipedia, they view often as the, the end-all and be-all of a reference. And they actually were very surprised to learn that that figure was 90%. And that is, a huge statement, but the way that that figure was determined was they looked at 10, this group did like a peer-reviewed review of the literature on 10 of the most common and most expensive healthcare conditions in the United States. So cardiovascular disease, depression, and 8 other disease states. And so looking at Wikipedia, they looked at the entries on those topics and then compared it to peer-reviewed literature, and they found that 9 out of 10 of those topics actually were found to have pretty egregious medical errors in them. So again, it just really emphasizes the point is more and more information is out on the web. There's importance for health literacy online for kids as well as for adults. So in terms of what's been going on with Real Talk since I was here last time, my activities remain in 3 major areas. One is with generating content for the website, which we talked about last time. The second major piece is a lot of interaction with teens, young adults, and with adults who support teens. Formally, informally, with teen advisor groups, but then also through professional meetings across disciplines. And then the third piece is that I've been collecting a lot of information to really understand how teens access the web for health information, because I think that for anybody that's interested in supporting teens, this is useful information. So for today, I was just going to focus on these 2 pieces, describe one of the professional meetings at the College of Physicians, which I know you all are aware of, and then also to talk very little bit, like scrape the tip of the iceberg in terms of some of the data that I found with the survey that I've done. So to start with the survey, I put together a paper-based survey that I actually got so much useful information from it that one of the college students that's been helping me out suggested that I turn it into an online survey, which I went ahead and did. It's an anonymous survey. It's exploratory. You should not put any statistics around it. It would be inappropriate, even though you can put statistics on anything. But the goal of the survey was really to understand how adolescents access health information. And the way the questions were put together, there was a grid where kids could check off for about 15 or 16 different health categories. Where would they go looking for information? And they could check off more than one. So, depression or suicide, sexual health, alcohol, e-cigarettes, body image, self-esteem, those sorts of categories. And then on the grid was parents, teachers, health educators, physicians, nurses, coaches, friends, internet, siblings. And then at the end of the survey, I left some free text fields where I was curious what they think adults misperceive about teen health, and then what they think adults misperceive about social media. And whether or not it's true that that's what adults think about teen health or social media, it kind of doesn't matter because it's from the vantage point of the teen and what they think. So this is just a little tiny bit of the information that I got out of this, and I decided for today to focus on the depression and suicide piece, because this is obviously an important area. The top graph just gives you a sense of the distribution of the age of the respondents that we got. So you can see that it's largely in the high school age group, but as young as 10, as old as 23. And then I did a split by age and by gender. Some of the places you'll see no gender or no age, and that's because in the first version of the survey, that field wasn't on the form. But when I converted to online, I added in those fields because obviously that's useful information. And when you look at the totals, which I don't have the total bar graphs here, one thing that is striking is that with depression and suicide, 60% of teens in this survey go looking somewhere for information on depression and suicide. So it's a remarkable number how many are looking for information. But the piece that was particularly striking to me is that teens will go 4-to-1 to the internet compared to the adults in their lives for information on depression and suicide. And actually they go 2-to-1 to the internet to their friends. So they're going to the internet predominantly for information in this area. And you can see that that pattern holds true by the different age bands, by gender. And one thing I would like to point out is there's a lot of data that shows that teens are actually more likely to go online looking for health information in general than to their parents by the age of 16. So it kind of flips, whereas earlier in the teen years, parents are a primary resource. And you definitely see that trend here when you look at the pink bar, which is the 16 to 19 age band. So to put a little flavor around that, I talked about the free text field. So in the category specific to mental health, what do adults most misunderstand about teen health? I didn't put a label on the topic there, so I let kids write whatever they wanted. And these are just a couple of quotes that I thought would be of interest to put some color around the graphs. But that we are under more stress than they think. Adults seem to take physical concerns more seriously than mental issues. Mental disorders aren't made up to get attention or meds. And one of the things that I just want to point out in terms of my impression of looking at the bar graphs and the numbers in constellation with the quotes is one of the things I'm concerned with is if kids are really perceiving that the adults in their lives don't take mental health seriously, that's why they're going to the internet. That may only be one piece. It may be because they're trying to become more independent and to manage their own health and to get information without scaring their parents and so on and so forth. But I do think it's something that we as adults who care for teens need to be aware of. This is a snapshot of where Real Talk is now. When I was here last time, the blog was sitting on the blogger page. All of that content's been transferred over onto a website, and a significant improvement has been made in doing that there's a search bar where you can search content and it will only produce results on the search on the website. So I know that the data that is, or the content that is generated with the search is content that I've endorsed. And also there's an ask a question box. So kids can type in an anonymous question. I don't know where it comes from. I can't see who it is. It's literally just a field that pops in as an email trigger to me. They get an automatic response back that says, thanks for your question. Questions will be answered for everybody. If this is a question specific to you, you need to contact your doctor because obviously they know you best, that sort of thing. And then I'll take that question and turn it into a blog post. And then to shift gears a little bit, the other thing I wanted to talk about was the College of Physicians, the Public Health Day. And obviously work like this can't be done in a bubble, and I've been grateful for many collaborations. And one of the most fruitful collaborations has been here with the Radnor Board of Health, and in particular with Mary Ann, and I know last year with Amy as well, with the interns the year before. But this year I was grateful to have Mary Ann give me the heads up about the call for abstracts, and so this seemed, since the emphasis of the meeting was on projects that had collaboration across organizations, this seemed like a perfect thing to discuss. So we went down there about a month ago now, and the way the setup was is you would get up for 5 minutes, kind of give little teasers about what your program is, and then go to round tables, and then people could kind of come around to the different tables and talk about the programs they were most interested in. And that was a nice setup, although I was jealous because I didn't get to go around to a lot of the tables on the first session. But I think there was a lot of interest, which was good. People are very interested in ways to use social media and the internet to help promote public health. So there was definitely, I think, some interest. I don't know if you want to comment on your impression. I was pleased with how the day went.
I don't want to interrupt your talk, but she was the most popular doc there. We were pulling chairs over from other tables, and other people, sadly enough, were sitting by themselves. So Dr. Offit really wowed them. And thank goodness for some young people that could set my computer up. So we had multiple computers and people, so there was a huge interest.
And then out of that day, it's yielded a couple additional collaborations, and one of them actually earlier today, I was at Central High School in Philadelphia with Herb Hazan, whose name you probably would be familiar, and I think he probably talked with you about this project, but the College of Physicians, of which I'm a member, and Central High School are trying to do a collaborative project really for getting graduating seniors to be ready to manage their own health and be their own health advocates. And so there's two pieces of this project, and the piece of the project that they were interested in having me come in is separate from a mental health piece that'll be covered elsewhere, is to work with them, brainstorm for some sort of project to just help arm kids with good decision-making capabilities and good resources, and kind of a plan, a proactive plan for when they graduate from high school and then move into the college years. I think their matriculation rate is 98% or something. So that's really in its infancy now, but that seems like a very exciting collaboration. So that's it. Hopefully I stayed in the time. Happy to take any questions either today or you know how to reach me.
Just out of curiosity, do you have any idea the differences between the access to the internet for searches about suicide and things like this as compared to what used to go on for more like these teen suicide hotlines and things like that? Was that more, were people accessing those prior to internet access more than parents and doctors? Or
That
is this sort of
I don't
substitution?
have that. But you raise a good point, because as the medium has changed, where people are going separate from, you know, parents and adults in their lives has changed. Although, you know, we still have the same problems with stigma. And one thing I do hear just in talking casually with kids, and I'm sure many of you have heard the same thing, like they don't want to upset their parents, they don't want to worry. They may have a question, but they're afraid of, you know, the complete explosion of fear that's going to happen if they just ask a question. So, you know, our teens are trying to protect us as well. So,
And from a personal experience as a pediatrician, I think that that's what I see a lot of, is that kids search the internet as sort of a quick anonymous way to find out, am I different from everybody else? Is this something weird about me? And then they get sometimes good information and they sort of drop it. And other times they come into the office with all these fears and worries about something they've researched on the internet. And sometimes we can provide them with some comfort to say, look, this is not what you're reading on the internet. There's something better. But I think I do appreciate so much that your website is full of good information and facts for people, and it's a shame that we can't just Google and get the good stuff and unfortunately get everything.
yeah. And I mean, you kind of hit the nail on the head that the primary way that they get information is asking Dr. Google. So,
Right.
so.
Well, thank you.
Dr. Foreman, to back you up or to address your question, years ago, when I've been out of education 3 years now, but I'm working with Dr. Offit, the suicide hotlines, I told my students not to call them because the people that answered the phone only had 20 minutes of training. And you cannot talk a child off a ledge with 20 minutes of training. And that was scary but the biggest problem, I feel, is adults still are not comfortable with mental health. And until we become comfortable about everything that surrounds that, as parents, as grandparents, as citizens, it is an important part to say to your children, it's okay. This is okay. Everyone goes through these difficult times, and they have to be able to talk to you. So I don't know how we get to that piece, but that's why our children are going, and I can only hope that they all find Dr. Offit. But the reality is they may not. So.
Well, thank you so much. Appreciate your presentation.
Thank you.
And in essence of time, I think we'll get to Dr. Leader as well for lung cancer.
Do you want to hold me? What do you want to do?
We can get it done this month, if that's okay. You prepared? Yeah, let's get that part. There's just a very little bit afterwards. I don't think I see too much public participation, so we should have plenty of time to get through the rest of the meeting. Thank you, though.
We'll go quick. All right. Where's the little guy? Are we in this guy? There we go. Okie dokie. Okay. There we go. Okay. I wanted to update the board and get some information out to the residents of Radnor because we've had some updates and changes around screening for lung cancer. So I thought it would be timely to do a quick presentation about lung cancer screening because you might have been hearing about it in the news and you may be asking questions about it and what does it mean for you. And so let's see what we're doing here, up and down. Okay, so these are 2015 estimates for new cancer cases and deaths. We have new cancer on the left and estimated deaths on the right. And you can see that lung cancer or lung and bronchial cancers are high for both new cases and for fatalities. So this is a serious public health concern across our country. It continues to be a serious problem. These are our trends in age-adjusted cancer rates, and I have males and females, and you can see that lung cancer is just up and above some of the other cancers that we deal with at any one time. And for both, this is males. The current trend we have peaked and we are declining, and you will see the same trend for females. And again, it remains a top cancer for females, and our trend is now finally declining, but rates still remain higher than other cancers. So again, the overall burden for lung cancer is quite high in our country. And as you might expect, and you probably are aware that this trends exactly with cigarette consumption over time. And so you can see how in the blue line there, cigarette consumption peaked and then started to phase out. And as there was a lag time between when the cancers were diagnosed and then you saw that peak and decline. And so it's following trend right on spot. And so the number one risk factor for lung cancer is, of course, smoking or tobacco products in general. Just for the general public, there are lungs. You can see the cancers develop internal to the lungs in the small tissue cells there, just so you have a little anatomy of what we're talking about. So these are the current screenings for screening guidelines for lung cancer. These screenings actually came out in late 2013, but they recently gained traction in early 2015 because Medicare is now covering screening for lung cancer. So you're asking yourself, I get my colonoscopy, I get this screening, I get that screening. Should I be screened for lung cancer? There's only a certain segment of the population that really should be considering lung cancer screening, and that is if you're current or former smoker, if you fall in this age group of 55 to about 77, and if you have a smoking history of at least 30 pack years. And you can see how you would calculate a pack year. You could say that's 1 pack a day for 30 years. 1 times 30 is 30 pack years. You could say that would be 2 packs a day for 15. 2 times 15 still gives you 30. You can think about it in all different ways. But essentially, if your number of packs times how long you've been smoking comes up to a number of 30 or greater, and you are in the age range of about 55 to 77, whether you're current or former smoker, you really should be considering lung cancer screening for you. So if you meet those criteria, you would want to talk to your doctor about whether lung cancer screening is right for you. You still have some decisions to make, but if you fall in that category, you might want to consider this now. You might hear different kinds of lung cancer screening. There really is only one that has been approved, and it's recommended for a population-level lung cancer screening program, and that's a low-dose spiral CT or a computed tomography there. That's the only one. You might hear things about chest x-rays and other kinds of screening, but you really want to ask for a low-dose spiral CT scan if you are considering lung cancer screening, and if you are, that is the kind they should offer you. And it's an x-ray machine, and it does a scan of your lungs. If you were to come back positive, you might need an additional scan, you might need a biopsy, but that's where you start. So if you do fall in that category of current former smoker, you're between 55 and 77, your pack times years comes up to 30, and you are considering it, then this is something you'd want to do once a year. And so you're taking on a little bit of a responsibility to do this annually, not like a colonoscopy, which is 10, or some of the other screenings, which are 5. So if you are going to do this annually, there are, of course, going to be some risks for you. There is, of course, repeated low exposure to radiation annually, so you'll want to weigh the risks and the benefits for that. So it's therefore only recommended for those who are at the highest risk of developing lung cancer. That would be those heavy smokers who are of an older age group. And again, if you're thinking about screening and you fall in that category, then you want to talk to your doctor about this. Screening has been recommended to stop once you turn 81, or if the smoking period has gone past 15 years, you can consider stopping. Or if you have some kind of a health problem or a comorbid condition such that if they were to find any kind of lung cancer and you needed surgery, that would be counterproductive to you, and so you would not want to consider screening at that point. So just to think about, to wrap up, of course, the best public health message in all of this is actually to quit smoking. And I think this is a great little pictograph, I guess you could call it, infographic from CDC about how your body begins to start to recover and sort of gain back its health after smoking, starting just 20 minutes, 12 hours, all the way to 15 years. So really, while we can talk about screening for those who've been smoking for a long time, really the public health messages here is just to think about quitting smoking as well. And there are, of course, resources out there for you to help quit smoking. Smokefree.gov is the government's website that has a lot of great resources about quitting smoking there. And of course, the 1-800-QUIT-NOW is the number that's used across the country. If you're thinking about this, you need to fall in that age group of being an older or a heavier smoker. I did mention that starting in February of 2015, it's covered by Medicare. And if you are familiar with the public health prevention guidelines and rating systems, the screening for lung cancer has gotten a B recommendation, which means it probably or should be covered by most insurance plans because they're covering things for A's and B's right now, and this is a B, if you understand what that technical jargon means. So again, if you're thinking about screening for lung cancer, know the risks and the benefits and the who's eligible, and then talk to your doctor. And I think that's all.
Thanks very much. Definitely new information for me.
Any questions before I move? Okay.
Thanks very much, Dr. Leader. Okay, I think we'll move on to some announcements quickly and then talk about next month's meeting. Announcement that it is Healthy, Safe Swimming Week as we move into the spring and summer. So, of course, we'll have great supervision for children around swimming areas. We try our best to also, follow all of the rules of the pool / lakes and streams that you'll be in. It's also Hepatitis Awareness Month. This is an interesting year for Hepatitis Awareness Month. This is the first year that there has been a accessible drug for hepatitis C. Obviously, anybody in the public with hepatitis C should see their physician. There are 2 new great medications for hep C that can actually cure that disease, which in the past has been a very difficult virus that can cause liver failure, liver cancer, and other medical problems because of congestion of the liver. Next month, we will have a representative from Bryn Mawr Hospital and the Mainland Health System to update us on Bryn Mawr Hospital's changes, which from memos that I've been getting about Mainland Health are still going fast and furious, as well as throughout the system of Mainland Health. There has been a lot of changes, so we'll get an update next month from Andrea Gilbert. If there is, I don't see any public participation. Any other participation from any members on the board that I haven't covered today? Then we shall adjourn our meeting and let the Board of Commissioners meet. Thank you so much for attending, and June 15th, Monday, June 15th is the next meeting in this room.